thank everyone for attending and to learn about the 2021 HR Department of the Year Award Excellence winner for Wellness. This is the 25th anniversary of the HR Department of the Year Awards, and every year we give out multiple awards at an awards program in November, generally at the Crystal Tea Room in Philadelphia. Following the show every year, we get consistent feedback that the show was a great celebration, but everyone wants to know more about why a particular company won. Unfortunately, if we did that, the evening show would be way too long. So we decided to run a webinar series, which we're doing today, highlighting previous year's winners and having them share best practices and success stories of why they won. So today we'll be hearing from the 2021 winner in Excellence in Wellness, which is Thomas Jefferson University and Jefferson Health. So as an employee benefit consultant, I hear a lot of employers wanting to know what best-in-class employers are doing from a wellness program. So today you'll hear an inspiring presentation from Dr. Anita Jensen and Samantha Inch about how Thomas Jefferson University and Jefferson Health took their traditional wellness program, adapted it to the new reality of life during the pandemic and going forward. And today's presentation is entitled Establishing an Employee Well-being Culture. So you can see today we'll hear from the winners and then take you through a little bit about the award. So as a way of background, the award program was founded by Scott Rosen in 1998 with his belief that HR should have more recognition for the good work that they do, and really to raise the bar for HR professionals. And in our 25th year, we've been very successful. Started as a very small event and has grown into now we have 250, 300 folks gathered in the Crystal Tea Room every year as a great celebration to HR. So hats off to Scott for the hard work that he's done over the years. So from HR Department of the Year Award partners, so first would be Scott Rosen of the Rosen Group. Next would be David Panett of Challenger Gray and Christmas. And then me, John Ford from Tryon Marshall McLennan Agency. And then lastly would be John Toohey of Salvis and Stetson. And then thank you to our sponsors. So our diamond level sponsors is Kelly Benefits Strategies. Platinum is Comcast Business. And then we have our silver level sponsors, which is Contemporary Staffing, Double Star, Emerson Group, HRC Computes, Hub, Meditation for Leadership, Salvis and Stetson, and Tryon MMA. And then our chapter sponsors. So we work closely with a number of the local associations in promoting the awards and also trying to get drum up activity for applicants. So Philly SHRM, Tri-State SHRM, the Delco SHRM, and the Chester County Human Resource Association. As far as background on the awards and so forth, so every year we give several different awards. So we give a Department of the Year award broken down typically by small, medium, and large employers. And then we give what are called excellence awards, which are sort of domain excellence in specific aspects of HR, such as benefits, employee relations, technology, talent management, diversity, talent acquisition, wellness, compensation, and social responsibility. So the way the process would work is as an employer, you can nominate yourself or someone else can nominate you. And you can either nominate yourself for all of the different awards, or you can pick out the ones you think might work the best. Scott Rosen always has a way of saying, if 1 is the worst and 10 is the most perfect HR department, if you're anywhere from a 5 or a 6, we think you should apply. And then from there, either you can apply for the HR Department of the Year awards, or maybe you pick out a specific excellence award that you think your organization is best in. So from there, you would fill out an application. The applications are available on the website, which is hrawards.org. And then you can see applications would be due on the 26th of August. Okay. From there, there's a judging process. So Mark Spool is our lead judge, and he's supported by about 20 or 25 past winners that are judges. If you apply for the HR Department of the Year awards, there will be a face-to-face meeting with the judges to take you through your story. And then if it's an excellence award, it's a phone call. And then from there, finalists will be selected on September 15th. And then the award show will be on November 9th in Philadelphia again. And again, if you have any questions about the awards or about applying, feel free to reach out to any of the sponsors or any of the partners within the Department of the Year awards. Okay. So next, it's my distinct pleasure to introduce our speakers. Unfortunately, Dr. Anita Jensen is unable to join us today. She had an unforeseen conflict, and she's unable to join, but Samantha Inch will lead the entire presentation. So, however, by way of background, I think it makes sense to introduce both Samantha and Dr. Jensen, since they were a team, and it gives you a sense of where they were in the organization and how they responded to the organizational need. So first, I'll introduce Dr. Jensen, who again won't be here today, but I'll give you some of her background. After 24 years of experience as an organizational psychologist, her passion is executive and organizational effectiveness. Whether working with executives individually or in teams, she provides a thoughtful and considered assessment, coaching, and business-sensitive guidance to create individual and organizational alignment around a common culture and business strategy. She has supported executives and organizations across multiple industries, from healthcare, financial services, pharmaceutical, chemicals, and professional services. She is currently the Senior Vice President of Organizational Learning and Development at Thomas Jefferson University in Jefferson Health. Her extensive business experience and deep psychological understanding enables her to provide an astute practical guidance on both individual and the organizational level. Next will be our full speaker, which is Samantha Inch. Samantha is a positive psychology educator, wellness program director, and champion of mental health. Samantha's work is fueled by her own story. Once a public relations professional, she suffered from early career burnout and embarked upon a journey of self-discovery. While completing training in the science of well-being, she bounced back from her burnout, redesigned her life, and decided to spend her career in helping others, quote, do stress better. Samantha is currently the manager of employee emotional health and resources at Thomas Jefferson University in Jefferson Health. She is responsible for design, development, implementation, and alignment of the programs and initiatives that support employee health and well-being. Please join me in welcoming Samantha, who will be today's speaker.
Thank you, John. Appreciate those kind introductions. And again, apologies on Anita's behalf. She wanted to be here with us today, but had an unforeseen issue. So if you want to go to the next slide, I'll start with just telling you a little bit, very high level, about Jefferson. We are a very complex academic medical center. We're just having grown from about 35,000 employees just last year to about upwards of 42,000 employees. And that's because of our latest merger with Einstein Healthcare Network, which happened last fall. So that makes us second largest employer in Philadelphia. And our locations are dispersed across 2 states. We've got locations in Pennsylvania and New Jersey. And I think our health system includes now up towards about 18 hospitals, definitely over 100 outpatient practices. And our university includes about 10 colleges and 4 schools with over 200 undergraduate and graduate programs. So a very diverse workforce we're dealing with at Jefferson. You can go to the next slide. So the story, I guess I'll present this in narrative form, the story of how our work to embed well-being as an attribute of our culture, that really began at the outset of the pandemic, which many of the organizations listening in today might have a similar experience. For context, traditionally, Jefferson used this incentive-based wellness program for employees. We offer insurance-related perks to those employees who participate in these preventative wellness activities. And the program's really vendor-based. It's embedded within the HR team on the benefits side of the house, as I'm sure it is in other organizations that are listening. But as the pandemic emerged in those very early days, we quickly realized, okay, this on the stress management side, these acute levels of uncertainty, of fear, of shock among our employees, that's likely not only going to serve as an acute issue, but it's going to morph into more of a chronic, long-term emotional strain over time. We don't know what that's looking like or going to look like, but we expect that to happen. So our employee assistance programs alone probably weren't going to be integrated or multimodal enough to be able to sustain these downstream effects we predicted would come. And it was specifically, the anecdote goes, a call from our chief quality officer at the time, Dr. John Gleason, to our senior vice president of learning and organizational development in human resources, and that's Anita Jensen. And it was while she was in a Trader Joe's parking lot that they had this idea. It sparked the idea to partner HR and these experts, our experts internally from the Department of Psychiatry, of course, behavioral health experts in the field. So that idea was, let's think about forming this unprecedented partnership to be able to develop tools for our people to help them cope with what's in front of them. And Anita owns enterprise learning. She owns talent management and organizational development strategies at Jefferson. But because her background is in organizational psychology, as well as lots of experience in leading large-scale change, the organization's leadership and Dr. John Gleason at the time really turned to her and her team to take on the challenge. How are we going to deal with the emotional impact of the pandemic? We don't have, obviously, a strategy for this. You're the best leader to take this on. So it was from there that HR proposed this partnership with psychiatry, and they helped to provide thought leadership on mental health interventions primarily, and then that evolved to wellness. So it was a handful of leaders from our psychiatry department. They jumped in voluntarily you did change the slide. Thank you very much. They jumped in voluntarily to help us out. And that was all. Who decided to join was based on some organizational clout. We had our chair emeritus of the department, as well as the existing chair. Some joined just because they had a little bit of bandwidth in their schedules and were passionate enough to support the mission that we were about to embark on. And so we really saw that it was an ad hoc group of people coming together, leaderless group, Anita used to call it. So for the longest time, we called ourselves a think tank. It was a grassroots group of people tackling one of these most unprecedented threats to organizations we've ever seen, which is these insane levels of employee stress and trauma. I joined soon after that, and prior to the pandemic, I was able to participate and contribute to this group because I was facilitating classroom training on stress management skills, things like mindfulness, resilience, as well as emotional intelligence. And I have a background in positive psychology and coaching. So I pivoted that to do something I had never done before, which was to turn that content into resources that could be scalable. And so over time, our membership expanded on this group, and you see the list here of departments where there were representatives who joined us, not only for their expertise, but for alignment. For example, we started to bring in non-behavioral health experts, but just leaders that led various large employee groups like nursing. That leader would join us to alert us, here are the trends, here are the hot spots that we're seeing in nursing, here's what the issues are, the gripes are, the struggles. And then we were able to pivot and adjust our interventions based on what we were hearing from those various leaders who would join our group. Probably midway through the second surge of COVID, we became a committee, and everything really relating to mental health and wellness started to pass through us. And HR's role specifically, Anita and I were the only HR representative on this very heavy clinical committee. And we emerged over time as kind of the brokers of these new relationships, or her word is the tetherers of all efforts related to these areas, because there were, prior to the pandemic and during the pandemic, a lot of disparate efforts, a lot of people wanting to do one-off projects or take initiatives to help the employee well-being mission. And so underneath this umbrella, we were able to break silos and bring all of those disparate efforts and those disparate teams together. And it turns out we really did build something from nothing. Go to the next slide. We'll talk through exactly what we did. It was this group that eventually became the Enterprise Mental Health and Wellness Committee that met weekly in the beginning to like I said, understand these nuances of the various employee experiences throughout the ups and downs of the pandemic, whether that was obviously the physical and emotional stressors of our clinical staff dealing with severely sick and dying patients, or the nuanced challenges of our academic faculty dealing with remote learning for the first time with their students, or our corporate staff who are working remotely, dealing with childcare issues and a 24/7 workday, dealing with their own stressors. So for the first few months, we were getting our hands around all that and adjusting. That was the adjusting phase to really, frankly, the chaos. And I'm sure many of you can relate to that. Our employees were dealing with, again, the shock, the fear, this disruption of daily life. And so we were just churning out materials to suggest coping techniques that we thought might help. We created this kind of sequential series of emotional coping supports, things like we recorded audio meditations that could be downloaded and listened to privately. We started recording interviews with our behavioral health experts to make sense of what emotions we were all going through and the nonlinear nature of very difficult emotions. We started targeting specifically our employees who are parents, videos from our child and adolescent psychiatry teams who were helping to guide parents to help their kids cope with this sudden disruption of routines. There were so many kind of these asynchronous video, audio, tip sheets, worksheets that we were just churning out and storing all of on our employee portal underneath, one specific COVID well-being tab. And then we started seeing emotional exhaustion. I mean, we think we're emotionally exhausted now, but it was emerging in the spring of 2020 already, especially from our frontline workers. They were carrying the brunt of the stress. We knew we needed to expand our approach, but of course, given the unprecedented nature of COVID, there was no blueprint on how to do this, how to support the emotional impact of COVID on our employees. So that was the adapting phase. We began to reflect learnings from the literature about the experience of healthcare workers in the aftermath of other national crises, the September 11th attacks, the Sandy Hook shooting. And that meant while we continued this development of this on-demand approach, we really needed to help our people with the emotional endurance side of things, getting through the day, transitioning from work to home life and home life to work life. And we started then introducing high-touch interventions, things like drop-in support groups that would allow staff to process everything that they had just been through that day or that shift. So that was what kind of propelled us into this next slide, which was what became our approach. You can go to the next slide. Next slide when you get a chance. Thank you. So what you see here is eventually we developed enough resources to establish this organizing principle. It's based off the University of Missouri's 4-tiered approach to emotional support. And we Jeffersonized it, of course. So the way this is intended to be used is staff can look at this, or leaders can look at the pyramid and select a resource that meets their level of distress or stress in ascending order. So as the severity of their stress or trauma increases, they can see, okay, here are some support options available to me that are more specialized and high touch and probably more professional. So one by one, I'll just go through these at a high level. Tier 1 focuses on prevention and early intervention. Resources include things like, again, audio, video, print resources on self-care, self-help, healthy coping, skills-based education, everything that's self-guided. It really focused on using this tier to address what are the evolving challenges of navigating adverse times. And now, post-pandemic, we use these for anything that's adverse related. We just, unfortunately, at our downtown hospital had a shooting last year in one of our at our TJUH hospital. And so we pivoted and used these same resources that are generic enough to apply for any adversity to something other than the pandemic. The topics range from things like managing anxiety, understanding grief, learning about what actually does constitute trauma. Am I traumatized? When is appropriate to get help? And then moving forward, how to build resilience. And we realize that if an organization is really looking to create an integrated approach to organizational well-being, the strategy needs to go beyond just offering these individual resources. It really needs to leverage collegial leadership relationships to support the well-being of each individual. So Tier 2 is all about that. It recognizes that within an organization, you've got local teams, local leaders. They're in the best position to recognize and respond to team members who are experiencing challenges, emotional challenges. You've got, peers, close colleagues, and managers, usually the first to notice when somebody is suffering, or even knowing that their peers can often confide in them about things they're experiencing, troubles they're experiencing. So the skills of observation and noticing and mutual support, offering referrals, that became even more important during the pandemic. It's always important, but it really made it was kind of paramount during the pandemic. So we took that concept and created formal training opportunities for managers and what we called wellness champions in specific mental health modalities, training modalities, things like psychological first aid, suicide prevention training. And then we did other informal presentations just about the importance of mental health at key leadership meetings, which we'll get into in a second. When you go up to the yellow Tier 3, that includes what we call peer support. So those programs are anything from a formal peer-to-peer support program. The one we have for our clinicians is called RISE, Resilience in Stressful Events. It's formerly a second victim program that was developed at Johns Hopkins. And so we've adapted that to train our clinicians to support their fellow clinicians in the aftermath of an adverse event. So that program goes under that tier, as well as other virtual and in-person psychoeducational workshops on coping skills, just teaching people in a workshop format how to be present, how to be mindful, distress tolerance techniques, etc. And then a third category of peer support is just straight support groups, just general support discussion groups, not fully focused on skill building, but just an opportunity for people to process and get things off their chest. So in this tier, we had an interesting lesson learned. In the beginning of the pandemic, we offered drop-in sessions, as the variety that I just discussed, many times throughout the day and early evening. And attendance was spotty. Sometimes would be attended better than others, as we all know. Sometimes are just more popular than others. But overall, we realized it wasn't the quantity or the variety of topics or offerings that would make us successful here, but it was how we offered them. So drop-in wasn't really working. We shifted the approach to offer sessions through managers on a by request basis. So we would offer to come out to existing staff meetings or offsites, whether it's, give us 15 minutes of your 30-minute meeting or 30 minutes of your 60-minute meeting. And we found this approach to really work best because it takes the responsibility off of the individual to think, I have to deal with this potential repercussion of raising my hand or even logistics of signing up to some sort of Zoom thing myself. And instead, I get protected time. I'm already attending the staff meeting, and I get an added benefit, and I get to experience this in a group. And so that changed everything. We saw a spike in usage, not only positive feedback of the individuals who participated, but of the managers who appreciated an additional component to their kind of more tactical staff meetings. And then that was Tier 3. Tier 4 in the red involves just straight professional help or support. And that includes the employee assistance provider, but also internally, we had our Department of Psychiatry and Counseling. They opened up specific special sessions for employees. We had a pastoral counseling department that mainly works with patients and families, but extended themselves to go more internally towards our staff. And that continues to grow. So just last fall, we launched 2 new digital mental health solutions, our first kind of app-based solutions. One is called NeuroFlow, which is a self-guided wellness app. It essentially aggregates resources from the internet, everything on wellness that you could possibly be interested in, TED Talks, how-to guides on YouTube, etc. And we've got Marvin as well, which is on the opposite spectrum. If NeuroFlow is kind of tier 1, that's an on-demand, people can download that, do that on their own. Then at the top of the pyramid, you've got Marvin, which is this new teletherapy app. It offers this really unique pathway where you can see a therapist without a wait time. And of course, it's all virtual. So we're seeing some early interest in both of these solutions. And I realized I was speaking to John and the team about this presentation, and we talked about what about organizations that don't necessarily have the wealth of internal expertise of a health system. And I was thinking, these are the vendors like Marvin or NeuroFlow that are incredibly scalable for as many employees as you need. They're accessible, they're private, they're HIPAA compliant. And you can use a couple of vendors to be able to create, an existing wellness program. And if budget is an issue, there's also free external resources, which we tapped into as well. Resources like meditation apps, Calm, they sometimes offer free trainings or free trials or pilots. You've got YouTube, which has a plethora of trainings with professionals, workshops, and then you've got national mental health organizations and hotlines and websites. You just need an FTE or a portion of an FTE to organize and curate what really speaks to your organization, because there's free public resources everywhere on these topics. So we do a variety of sourcing, but overall our employees still do face barriers to accessing these resources. They're, no matter how free or scalable, right, or easy to use on their mobile phones, there are still time constraints. There are still scheduling conflicts. You think of a nurse trying to, use this app while struggling with multiple patients, or attend a Zoom workshop while ensuring, patient care continues. You've got staff, as I'm sure everybody does, that are just overall exhausted. So it doesn't, the pyramid has been incredibly successful, but it doesn't mean, all of our barriers and challenges have been negated. And so we've pivoted away over time from the resources that weren't widely used, like those drop-in sessions. And we do continue to see that this multimodal model really works, where you've got one, access at the individual level. Employees can seek out the mental health intervention of their choice. Some may do so, and some may still be a little bit too nervous to do so, but it's always there for them 24/7. Two, the team level, where managers can bring our interventions to their teams. They can sign up a whole team for a training. And then the third level is really the senior leader level, where we're starting now to work on leadership modeling, right? Leaders are modeling the fact that it's okay to not be okay. It's okay to talk about this kind of more emotional side of work. Emotions drive everything. We're starting to now openly talk about myth busting, this old school myth that you need to check your emotions at the door when you come to work. We know we're not going to get a lobotomy. We don't change our brain out. Things come with us. So that now, is starting to be appreciated more, and the idea of attending to your well-being while at work, and of course outside of work, is now part of the ethos of our discussion. And we've got a long way to go, but that's what we're starting to work on. So if you go to the next slide, when it comes to that leadership component, using leadership development to enhance and advance our well-being efforts, we really did take advantage of embedding our work into existing forums and meetings. We used the platforms to really give that greater visibility and that appreciation among leaders to why this matters now. It's always mattered, but why it matters now even more. So one example of this, about a year ago, maybe a little bit more than a year ago, our first real showcase of this topic at our executive leadership meeting. We have our top 350 and above VPs plus in attendance. And so we dedicated the entire agenda to this topic, and it began with context setting from our executive vice presidents, some offering some vulnerability about how they personally have struggled with the stress of the pandemic. We then showed a testimonial video that we were able to pull together of just very, man on the street on an iPhone. It wasn't high production value, but there were staff and leaders, our real people, talking about, I used this well-being resource, I read, this tip sheet, I watched this video, I attended this class. and here's the value I got from it. And then at the end of the meeting, or really the meat of the meeting, was we had this fishbowl series where we selected 4 or 5 leaders who each represented different various major areas of our organization. For example, we had a nurse who was responsible for patient well-being, faculty member responsible for student well-being, a guy from corporate, or one of our leaders responsible for the supply chain, for sourcing appropriate PPE and dealing with all of those logistics challenges. We had an outpatient practice administrator responsible for staffing and the tons of complications around staffing of nurses and physicians in the practice. And we matched each of these leaders with a member of our psychiatry faculty. And so for about 10 minutes each in this fishbowl format, we observed. We listened to them talk to each other, to them consult. And the leader would describe, here's my heaviest emotional strain. Here's what keeps me up at night. Here's what I'm worried about, not only for my staff, but it's starting to impact my well-being and my level of burnout. And then we watched the consultation take place where there were strategies, techniques that this psychiatry or psychologist would share, not only to help lower stress and focus on doing what's in your control, but to ultimately help the stakeholder of that leader. And it was one of the most powerful meetings we've ever had of that particular forum. Not only did we hear anecdotally, but the survey feedback that came in was the meeting was incredibly positive. Thank you for the tangible tips. That's helpful, but we're talking more culturally now. There's a power in shedding these layers and revealing this humanity of work. And there were a lot of leaders that really, said that this marks, a new era for us in how we're able to openly and transparently discuss these kind of hidden pandemic, the hidden impacts and the aftermath of working really hard. So that was one tactic. And this is, of course, all under the guise of how do you really start to impact large scale change outside of just offering these resources. So we did that. We also offered well-being topics in existing learning structures. So, under the learning and development structure within HR, there was an existing program called the Leadership Dialogue Series. It's a short teach on a particular leadership topic, followed by an open discussion. And so wellness topics that we started including were, as a manager, how do you build a toolbox to combat stress, to recognize trauma in yourself and others, to deal with adversity. We did a specific teach on what we called operational stress control. And this, we brought an outside speaker in to talk to us about psychological first aid for managers. And then we had one of our mindfulness instructors do a teach on presence and what does mindful leadership really mean. So these are all non-traditional leadership topics, but we started to see the majority of feedback not only showed we want more of this, but started giving us ideas. Here are the things that plague me. Here's what I like, the next topics to be on. And they were all in the well-being or stress category. So that was just kind of an interesting, and that still continues to this day, even as we're on the precipice of a new phase of the pandemic. Next slide. So going forward, we, like many organizations, I'm sure all of you, are now in this position to evaluate how has COVID changed things and how has COVID changed things for the better. So it was horrific in many ways. And many of us are still suffering from a PTSD-like experience, and we're working on that through interventions. But for an organization, there are silver linings. There's just the fact that COVID has helped us pull back this curtain, evaluate what works from the ways that we were really forced to do things differently. And one of the things we did differently was to adjust this psychological contract that we have between the organization and our employees. And we can probably say it's shifted permanently. For one, there's an expectation now and a need that the employee says, you need to continue to help me cope with the stressors on the job. So leadership has definitely recognized this. We're not letting that opening that COVID provided close. And the way to not allow it to close is to make employee health and well-being a fundamental attribute of our culture, instead of simply a program or simply a wellness credit that you get off of, on your insurance. And so, in a highly bureaucratic, maybe low risk culture, that might backfire. But if you have some open-mindedness, an innovative mindset, perhaps, people are open to evolution and process improvement. So we're not only continuing this work, but the pyramid work, but we've also aligned it with support from an executive sponsor, one of our executive vice presidents at the top of the organization. And he has worked with us to discuss broadening the mission beyond just mental health and emotional health. And he's also discussed with us adding credibility to our mission by changing the name from well-being or wellness to holistic health, which refers to, the whole person well-being or the whole employee. Again, beyond just the singular focus we developed on mental health during the pandemic.
What would that mean, Samantha? When you say whole being, like what you guys have done up to this point is amazing.
Yeah.
But where do you see it when you like, what would be the next step, do you think, to incorporating the whole being?
Yeah, we are taking an 8-dimensional model to define what whole person well-being means, and that is from the Substance Abuse and Mental Health Services Administration. You may have heard of it before. It's called the 8 Dimensions of Wellness. Of course, we're not going to call it wellness, but we're going to adapt that to help us shift, to help our employees start thinking about wellness differently. So those dimensions are listed here: physical, emotional, your spiritual health, your financial, literacy and acumen, your intellectual health and how you're growing and expanding in your career, the environmental health, your surroundings, occupational, of course, your workflows and the particular processes on the job, and then your social health, how you engage in relationships and meaningful belonging within an institution. So that's what we're really using to define holistic health, meaning, like I said, holistic meaning more than just one component. And sometimes we forget. We think physical, I've got to exercise or eat right, and I know therapy is available to me. I know mental health is important, but beyond that, sometimes we lose sight of these other major areas of our life that actually can be viewed through a health lens. So if you go to the next slide, I'll talk a little bit more about our initiative and how we're organizing it. We realized we probably shouldn't try to tackle all 8 dimensions at once. So we're going to tackle a couple per year. So it's become a multi-phased process to really, be able to do this thoroughly. This calendar year, we're in the process of doing 3 different things. First, just as a baseline, we're cataloging existing wellness resources, but the ones as well that aren't really wellness resources, but that do contribute to an overall employee's growth in mind, body, spirit, intellect. And again, we're starting to do that to help employees think, here's all the ways that I can enhance and attend to my own health. There's a lot of multifaceted ways. It's not just my diet. It's not just my doctor's visits. So again, things like learning programs, what trainings I'm going to, even my annual mandatory education go underneath intellectual health. I can start seeing them as ways to help me grow. Even my physical spaces, meditation rooms, the trails around my building at work. This can go under my physical or my occupational health. How can we creatively and mindfully think about how Jefferson can support employee well-being with the existing infrastructure, the existing policies, the existing resources that we have, without having it even built anything new yet? So that's an aggregation project. We're doing that now. At the same time, we're continuing our work in the emotional health domain. There's a lot of momentum there, as I've just gone through. And then lastly, we're going to chip away at 2 or 3 dimensions a year. So first, for the first half of the year, we've been working on the physical first. We took a Maslow's hierarchy of needs approach, said, let's start with the basics, physical first. So we're Jeffersonizing the meaning of physical health, or really just organizationalizing the meaning of physical health, because you think about how an individual might think, okay, what does physical health mean to me? I want to look at how I can care for myself physically at work. more than just making sure I eat right today, making sure I move around, move my body. And then at the end of the day, making sure I get enough sleep. I mean, those are things that really most individuals know. So Jefferson can continue to remind you of that and give you resources to help you with that. But we need to take it to another level. And that's what holistic health is all about, going beyond the individual resource. Now, we need to take it to a system level. Let's look at the structure of work. What is the structure of work's ability to uphold this definition of physical health? What are those management practices, the operational workflows, the technologies, the policies and procedures, and the physical environments that help employees be physically healthy? What are they? Do they actually detract from an employee achieving their physical health? So what we've done is to begin identifying how the structure of work, is what we're calling it, currently either helps or detracts. We did a small survey, just surveyed kind of a small sample size of staff and leaders, and they've revealed several operational barriers to achieving their physical health, all that go under the things I just mentioned: managerial practices, operations, technologies. And so we've culled those responses down into some top themes. Things like too many meetings, overwhelming workload, emails are unwieldy. And for remote workers, a struggle to put a boundary on the end of the day and the beginning of the day. These are themes that are not new, but that were exacerbated during the pandemic. And I probably think all organizations are struggling right now. But those were the themes that our employees came forward with. And now we're looking at, okay, if those existing practices and behaviors, those are so embedded into our culture, into our daily ethos, that even our highest level leaders say, I don't really know how to say no to a meeting at 7:00, especially when it's urgent. We realize these are outdated norms. So those norms are enforcing these unhealthy barriers. How do we redefine and shift some of these norms, shift some of these behaviors, start to peel back the onion and insert new, healthier practices so that we can pivot from what led us to this place? Again, a silver lining of the pandemic that has allowed us to kind of in the stop, start, continue practice, start to really evaluate the root cause of some of these well-being challenges.
Samantha, a lot of what you're talking about is manager training also. It sounds like you did some of that, but it sounds like there's a good chunk of this, changing norms oftentimes starts with the manager. So was that all done internally? Did you do any, outside? There's different sort of mental health, like mental health first aid and some of those other organizations. Did you rely on any outside vendors, or was it all sort of done internally from a manager training?
Great question. It was definitely multimodal. So yes, we had some internal expertise and existing trainings. We developed some new trainings, but we also did contract with some experts. We have one in particular who teaches psychological first aid and has adapted to all different roles. Manager training, yes, peer-to-peer training, staff training. He even does role-based training for clinicians versus non-clinicians. So he's been wonderful, and he's part of our RISE program, but he's helped us definitely consult on management training. So I think it's a mixed bag in terms of the internal expertise to be able to do it ourselves and bringing other experts in on a consistent basis and an ad hoc basis. After our shooting in October, we did bring in a trauma-informed organization specialist who kind of worked with us. We had people in our counseling department that could perhaps have done this, but we wanted to expand the aperture and get other evidence-based strategies to help us recover from that. So it's a mixed bag.
How about measuring effectiveness? I mean, a lot of times it's hard for a CFO or finance, given what we went through and what you went through specifically as a healthcare organization, to push back on investing in something like this. But obviously, the question at some point is going to be, we're spending a lot of money. What's the effectiveness of this? How were you able to measure the effectiveness?
It's a work in progress. So there was no way we could have done a baseline assessment at the beginning of COVID. We were just moving too fast to be able to say, okay, where are we now and where will we be after we develop this pyramid? So we've done a lot of in the moment kind of measurement of intervention effectiveness. So we have data that shows that's how we've pivoted the strategy this entire time on kind of a small scale. We have data that shows XYZ is ineffective versus this other intervention, and therefore, we've pruned based on those kind of small in the moment assessments. But we do, moving forward with holistic health, now that this is a more formal initiative, we started with this baseline survey about our physical health challenges, and we're going to survey once we implement some of these changes and these shifts that we're talking about. So we may going forward start to do a per pedal, or per dimension, per 8-dimension kind of pre-post survey to try to understand, are we moving the needle at all? Yeah, it's a great question about measurement. Our vendors also measure. So we, on a monthly basis, we insist that our NeuroFlow and Marvin vendors show us usage, satisfaction, and then we adjust from there. So it's a multimodal strategy to measurement. Hopefully we'll be able to streamline that going forward as we get more organized.
Okay.
Thank you. Just got one last slide here. If you go to the next one. Just a kind of closing lessons learned slide and summary. I mean, you've got the past 2 years, it slammed us with COVID, but we also had these other socioeconomic and political and racial factors that really have challenged the well-being stamina of our workforce. But as an organization, those things were completely out of our control. So our major lesson learned was, how do we continue to harness opportunities for change and do so with a great amount of open-mindedness, patience, adaptability, creativity, because when you're trying to pivot something that's been stigmatized for centuries and is so against the mentality of healthcare professionals, even non-clinicians, such as the idea of taking care of yourself. When you're up against that, you have to do small things to chip away at the change. And some of the things that we really took into our best practices pocket were being open to new partnerships, internally. They may not follow traditional processes of how you go about creating a team or a task force, but it's grassroots and it's serving a need. So therefore it's value add. It's worth it to explore and see where it goes. Two, HR stepping into this primary role of silo breaker and relationship builder and tetherer in terms of bringing together all of these interdepartmental efforts and making sure we were really speaking as one Jefferson and leveraging and harnessing all of these good ideas and this good work that were kind of popping up all over the organization. Pre-pandemic, HR might not have had the clout or the platform to be able to pull those efforts together. And now we're going to continue to do more of that. Another small thing that we did, but is a major lesson learned is the power of normalizing and naming and normalizing. This language of well-being, this language of emotions. Staff and leaders can now start to learn skills to develop enough self-awareness to understand, one, I'm suffering. It is normal. I don't have to hide it. Two, there's no shame in this because my leaders are starting to talk about this. And three, it's okay to not be able to handle it alone. And I know that there's these 24/7 resources that I can go to if I need it. So as an organization, we are far from achieving a perfect kind of destigmatized mental health goal. But the more openly we talk about it in meetings and workshops and trainings, the more it becomes normal and accepted. So we have had quite the experience. We're excited for what comes next for this holistic health initiative. Thank you, John. Thanks to the HR Department of the Year Awards team for honoring us with this Excellence in Wellness Award last year and for inviting us to share today. And hopefully there's some nuggets here that those of you watching can take away. Thank you.
Great. Thank you, Samantha. This has been great. Really appreciate all the work you did on behalf of your employees and for sharing that with us today. I think it's very helpful to the local HR community.
Thank you.
Okay. If you want to just go one more slide again, just to review, the applications are open. They are available at hrawards.org. The applications are due August 26th. Again, you can nominate yourself or someone else can nominate you. You can apply for the Department of the Year Awards or any of the Excellence Awards. Finalists will be announced on September 15th, and then we welcome everybody to join us at the awards celebration on November 9th in Philadelphia. So any questions, again, feel free to reach out to myself or any of the other sponsors within the HR department of the year awards, and we'd be happy to kind of help you through the process. So on behalf of the other sponsors and partners of the HR awards, thank you to everyone, and thank you to Thomas Jefferson University and Jefferson Health for sharing everything they did this past year. Thank you.